My name's ReneeBotox. I'm a master's prepared nurse at the Age Management Institute. I function as the aesthetic nurse specialist there. I have been practicing in that practice for approximately 8 years, and prior to that I've had about 20 years of plastic surgery experience. In addition, I work as a clinical instructor for aesthetic advancements, in which I travel and teach other physicians and nurses how to inject products. Many of you have heard about Botox. It's one of the most common non-surgical aesthetic treatments currently in the U.S. Along with Botox, there's actually 2 other FDA-approved products. So if you hear about Dysport or Xeomin, all 3 of them do the same function. And what they do is they basically relax muscles in the face that are causing wrinkles that we don't like to see. So most of it is animated lines when we think about crow's feet or raising our forehead and seeing lines. What you do with Botox is it's an injectable that smooths that muscle out and then will smooth the skin on top, giving you more of a relaxed, refreshed look of the face. When you come into the Age Management Institute for a treatment, you will have the opportunity to have a mirror, and we will discuss areas of the face that you would like to be addressed. For example, it may be animation lines when you raise your eyebrows, the lines across your forehead, the frown lines that may appear here. It may be crow's feet. It can actually even be little lines around the mouth. The procedure is actually very pain-free. I use a very tiny needle, and the injections will be placed in various areas where the muscle is that I want to address. After the procedure, you'll actually be able to go on with your regular activities. The actual results of the treatment do not take place for about 1 to 2 days. About 1 to 2 days, you start to notice a little bit of change when you try to make certain facial muscles a more relaxed feeling. At 2 weeks, you will get what you're going to get, basically. And then I'd like to see you at 2 weeks. I do a thorough assessment. We decide if we need to add some more or if we're right on. From that point on, you can go about 3-4 months and then come in for another procedure. If you're considering this particular procedure, I would be happy to discuss it with you. I offer a complimentary consult where we can talk about any of your questions, concerns related to any of your skincare needs.